Living with Crohn's is humiliating. You take tons of medicine, you deal with tons of side effects of the medicine and of Crohn's itself. It's just not fun.
When I first met Miss Kaylee, she was actually in the hospital with severe debilitating Crohn's disease. She had stricturing and fistulizing disease.
He came in, introduced himself. I think he even gave me a hug right from the beginning. Probably knew I needed it. But he explained to me a little more of what was going on. He had images, and he explained everything, like questions I didn't know to ask. So that was like a mixture of emotions. I was like terrified, but at the same time I'm like, this man really cares. Like, where did he come from? Who is this? He called me on the 6th, the night before my surgery. And I didn't know who was calling. It was like a Florida hospital number. I'm like, oh, they're just calling to confirm my surgery, to tell me what time I was there. I picked up the phone. And it was him. And he's like, I just want to make sure you're okay. It's like, and that's when I knew I was in good hands, because I was okay. And I never, ever would have thought that.
She underwent a short course of nutritional therapy and anti-inflammatories. And we were able to laparoscopically do a surgery where we removed those segments of disease and provide her an anastomosis. That means putting the bowels back together without any ostomy bags or diversions. Since then, Kaylee has had an excellent recovery. She was in the hospital for a very short period of time, and we're thrilled and rejoiced that she has her life back on track. She's working full-time. She's loving and living life as she appropriately should be.
My experience with Dr. Chizinski was amazing. He was compassionate and very knowledgeable. And I felt very comfortable being in his care, and he was just very genuine. The nurses and the whole staff during my stay did everything they could to make me feel as comfortable as possible. They brought in therapy dogs, they would send chaplains in, like anything. If I started getting anxious, they would do anything they could to help me. I never waited. When you push the call button for medicine, I never waited. It was a great experience.
Kaylee's a great advocate and a great example of how we can help patients here at Florida Hospital Tampa. She regularly checks in with us. She follows up with her gastroenterologist and is always quick to come by and say hello and give her thanks and appreciation for how her life has changed and how we helped change her life. There's nothing more gratifying as a surgeon than seeing that, and to have a patient come back who you've seen in such duress before, who's now just full of life and full of love and joy. It's really a privilege to be able to take care of a patient like that.
Life after surgery has been amazing. I have no restrictions now. I can go out to theme parks. I can walk around now. I'm not sick. I'm working on my master's, and I have the time to do that. I have the energy to do that now. So it's like nothing's holding me back anymore.